Hi, my name is Victoria Walsh, and today I'll be giving a presentation on the effects of prenatal exposure to alcohol and how it affects a child as they start to grow through their first few years. So just some general facts. Fetal alcohol syndrome occurs in 1 in 1,000 births, making it the leading environmental tetragen. A tetragen is any agent or factor that can cause malformation of an embryo. Also, fetal alcohol syndrome is the leading cause of intellectual disabilities in the United States. 1 in 30 women report risk drinking during pregnancy. Risk drinking is defined as having 5 or more drinks in one period, or having 7 or more drinks over the course of a week. This is a pretty high number, and a lot of people question why 1 in 30 women are saying they drink during pregnancy when they know it's bad. But that doesn't bring into factor, addiction, which is a big issue. So there's been a lot of studies out on how much alcohol is too much alcohol when you're pregnant, and a lot of the reports have given mixed results. Some reports say if you drink less than a drink a week, that your child will be fine, but then some report as much as 1 drink can affect a child when they're born. So basically the Surgeon General has just made it that he warns against drinking when you're pregnant, that there's no such thing as safe drinking when you're pregnant. So it is very, very important to stay away from alcohol during your pregnancy. But again, this is difficult if you are suffering from addiction. So as soon as a baby is born, the doctors and the nurses are able to tell almost automatically that the child is suffering from fetal alcohol syndrome. This is because they usually have some facial deformities. Some of them are a very small upper lip, a smaller than average head size, small wide set eyes. They usually have a very low birth weight. And also when they do further testing, they realize that there are some cardiovascular, respiratory, and digestive issues as well. So here are some pictures of a child that's suffering from fetal alcohol syndrome. You can see that their head is small. They have small little eye openings, and their eyes are far set apart. They have a very small upper lip. They have a little nose. Their jaw is underdeveloped. Also, this is a brain scan. This brain is a normally developing 6-week-old. And then this is a 6-week-old that is suffering from fetal alcohol syndrome. As you can tell, the size first is like the child with fetal alcohol syndrome is much smaller. And you can see all these dark spots on their brain. So as a child begins to develop into their first year of life, they're unable to control their emotions. They throw tantrums, they cry, they're very unhappy babies. And also within your first year, your fine motor skills start to develop, so like picking up spoons and forks and doing those kind of things with your fingers. But children with fetal alcohol syndrome really struggle to meet this milestone. Also, they find that children with fetal alcohol syndrome are not participating in social play, so they're not really playing with other children their age or really anyone at all. They're kind of very lonesome. Also, Mary Ainsworth talked about the different types of attachment in children, and there's 3 kinds, and they find that many children with fetal alcohol syndrome have these insecure attachments to their caregivers. And they find that children with insecure attachments tend to be not as confident, they tend to be not as social or outgoing as they grow up later into life. So as a child starts to progress from their first into their second year of life, this is around the time when your social-oriented emotions start coming into play. So those are things such as pride, guilt, embarrassment, shame, empathy, etc. But children with fetal alcohol syndrome and these neurological behavior disorders, they tend to not feel these emotions, or they struggle to feel these emotions or understand these emotions. Because of that, it makes it really difficult for them to establish relationships with other children, parents, people, etc. And children with fetal alcohol syndrome have been unable to accomplish proper socialization and communication skills for their age group. So as a child with fetal alcohol syndrome begins to enter school, this is where you can really tell the difference between them and then their normally developing peers. So they have all these emotional and behavioral issues, and then in school they really struggle with, paying attention. They're very hyperactive. They don't really understand concepts or anything that's really abstract. They really especially struggle with like taking little pieces and being able to see the whole picture of things. So there's been a lot of debates on whether or not bringing children with fetal alcohol syndrome or really any other disability into a normal classroom is productive or not. One side of the argument is that, it teaches these children to socialize, and also when they see their other normally developing peers interacting with the world, in a classroom setting, they will hopefully mirror these actions, and that it gives them kind of a goal that they can reach. But also on the other side is that some children with fetal alcohol syndrome, a big classroom setting is very scary for them, and it's too much. They really struggle socially and emotionally, and then putting them into this situation makes it even more difficult. So some children really benefit in a smaller classroom setting with specific aids that can help them with their with their specific needs. So there is no cure for fetal alcohol syndrome. The biggest thing to do is early intervention. That's the biggest help for a child with fetal alcohol syndrome. There's a ton of counseling programs in special schools that can help them, develop those parts of their brain that are lacking. So fetal alcohol syndrome is a spectrum, which makes it very difficult to make generalizations. So it can change case to case, child to child. It really depends on how severe their fetal alcohol syndrome is. And like I said before, early intervention is the best. A lot of people say, patience and repetition working with these children is the best because that's how they learn the best. And there's also a ton of online resources to help someone who is coping with, raising a child with fetal alcohol syndrome or teaching a child with fetal alcohol syndrome. So as you can see, fetal alcohol spectrum disorder is this umbrella, and then there's all the disorders that fall underneath of it. And with fetal alcohol syndrome, there's the primary disabilities. They struggle in class, they don't understand concepts, their emotions are all over the place. But then there's also, these secondary disabilities where it'd be very difficult for them to hold down a job or for them to live on their own. So there's many different issues that come along with fetal alcohol syndrome as a young child, as you continue to grow up. So the biggest takeaway message from this entire presentation and from all of this research is that there is no safe amount of alcohol to consume during your pregnancy. The risks are just too great for a child that really has no control over the situation, because fetal alcohol syndrome is something that they're going to be struggling with for the rest of their life.